Development in science and technology has made it possible to have advanced treatment, making progress in health sector in the country. Speaking immediately after the first ever brain surgery in patients using artificial intelligence technology at Muhimbili Orthopedic Institute, MOI, the executive director of the institute, Dr. Mpoki Ulusubisya, says that the success is due to the massive investment done by the government.
It's our privilege to thank God for the step that has given us another milestone at the Muhimbili Orthopedic Institute in Dar es Salaam, where the very first brain lab conducted procedure of taking a brain biopsy for a tumor that was deep-seated in the brain has been conducted. And this was under the hand of one of our own doctor, born, bred and raised here in the country.
Dr. Ulusubisya added that the availability of such modern equipment will make it easier for them to save more patients.
All I can say is that any patient with a deep-seated brain tumor will be a candidate of the service of this machine when they want to do a biopsy before we know what kind of swelling that is. Now, so we can't say how many will, but we say all those with such a problem will benefit from this intervention.
How big is the problem of brain tumors in Tanzania?
What is the disease burden in our country with regard to brain tumors? There is no really data, published data on the epidemiology or prevalence of the brain tumors in the country. But what we have is the institutional series or institutional report, whereby we have on average 600 cases, 550 to 600 cases, which we receive in a year. Back in 2008, specialists were only 3 in this hospital. But now we are talking about more than 15 specialists, super specialists actually.
The director of brain surgery from the Weill Cornell University, USA, Professor Rogers Hertz, says that the arrival in Tanzania will also help establish a comprehensive service for the patients with spinal cord problems.
Our vision is to do exactly the same thing here in Tanzania at MOI, to bring together all the specialists that take care of spine patients, in addition to the surgeons, and make this also a comprehensive spine center.
Since the institution entered into a partnership with Weill Cornell University of the USA in 2008, a number of MOI specialist doctors has increased.